Hello everyone. Today I am starting a new series for the PYQs. I am starting with the anatomy today. We'll discuss about the 2017 paper. Here, who have already read about the anatomy, and if you are just want to read passively, then this will help you the most. I'll give a short explanations which will help you just to remember and passively read through. So now, if you are starting anatomy first time also, you can see these videos and it will helpful because you will get to know which topic important. Yes, let's start. First question is nucleus pulposus derived from. This type of questions actually INICETs they will ask. First now nucleus pulposus is derived from. We know that it is derived from notochord. It is derived from the cord-like structure. You know mobile cord, C type, B type, mobile cord, charger cord. The same type of cord structure will give rise to the nucleus pulposus. So we have to know which is the new notochord in this diagram. See, first we can see two. Two is nothing but a ectoderm, and next three is something. It is a tube-like structure, isn't it? So it is a neural tube. And next one is neural crest. It is a crest, neural crest cells. Whereas 4 is nothing but it's like a cord structure, hence it is a notochord. So here answer will be notochord. What are the other structures remnant of notochords? Actually, one liner. Notochord will stimulate neural crest cells to form neural tube. Neural notochord stimulates neural crest cells and then it forms a neural tube. Okay. After doing its duty, next it will be the remnant. It will form a nucleus pulposus. It is present in the disc actually. Tectorial membrane and apical ligament of Dens. All these three are the remnant. Okay. Next, coming to the second question, what is the origin of the fibers marked by the arrow? This is actually a favorite question of INICET. It's frequently asked question. Now the marked structure here in the pink color they have marked, right? That is nothing but the fornix. Fornix. So they are asking, it's not about the fornix, they are asking the fibers which originates are present in this fornix are origin from which structure they are asking. It originates from the hippocampus. This structure here marked is the hippocampus. Okay, you can see the structures if you want. I'll show you. See, this is the first one is the cingulate gyri, and next we'll just wait a second. Okay, cingulate gyrus, and this 2, 3, 4 are the corpus callosum, and 5 is the fornix. This structure they have asked there. This 9 is the anterior commissure, and 10 is the posterior commissure, and seventh one is the thalamus here, and sixth one you have to know that is caudate nuclei, and this much you have to know. In corpus callosum you have to know that this 2 is nothing but genu of the corpus callosum, and this is the body, and this is the splenium corpus callosum. This identification is also important. And 13th one here, small ball like structure, that is a mammillary body. Okay, good. Next question, coming to the third one. Here, among which of the following And among the following, what is the function of marked structure? They have marked this side. This is the lateral side, whereas this is the medial side. So, lateral pterygoid, what it helps in, its main function is to depression of the mandible. Hence, it will help in the opening of the mouth. Opening of the mouth. Yes, this much. Yes. Now coming to the fourth question. Which of the following marked foramen does mandibular division of the trigeminal nerve passes through? First, we have to know that mandibular, man, I have, there is a funny thing. Man loves ova, isn't it? Man should love a ova. So, man will come, mandibular division of trigeminal nerve comes from the foramen OLA. Now, in the A, B, C, D structure, foramen, from which one is the foramen OLA? You should know that. This, the OVA like structure is foramen OLA. So, marked by A. So, option answer is A. Now, you can see I have told foramen ovale, ova is loved by whom? Male. So, male means which all male structure? Mandibular nerve and accessory meningeal artery and amensary nerve and lesser petrosal nerve. Okay, these are the male structures, but you can remember man loves ova and mnemonics is also male. Next, foramen spinosum. Here there is a why it is spinosum. It is a very small structure. I'll show you. This is a small foramen is there, no? That is the foramen or spinosum. Here the middle meningeal artery and vein comes, and also nervous spinosus also comes. Now coming to the internal acoustic meatus, we have one external acoustic meatus. You can see that in the ear, and another one is internal acoustic meatus, which connects ear to the brain. So what all nerves? Facial nerve, you know, and eighth nerve. You have to remember both will go through the ear. You know facial nerve course, right? It also enters the middle ear cavity, whereas this vestibular nerve obviously is for ear only. So next, jugular foramen, all 9, 10, 11 nerves comes from jugular foramen, and there is internal jugular vein in that and inferior petrosal sinus, meningeal branches of the ascending pharyngeal and occipital arteries also comes from the jugular foramen. Okay, fourth one done. Now coming to the talocalcinonavicular joint is the dash type of joint they are asking. So we feel that these three are joined, right? So something confusion, but you don't get confused. It is a ball and socket type of joint. Let's see other joints also here. Now, first, these are the synovial joints only. The plane joint. Plane means it works only in the plane, so flat will be there. It is for the intercarpal and intertarsal and vertebral facets. Next, hinge joint. Hinge joint is nothing but a door. You know the door opening and closing. Hinge joint. That is for elbow, ankle, and interphalangeal joints. Next, pivot joint. Here there is a rotational movement. Actually, it is a radio-ulnar joint and atlantoaxial joint. In the you can remember the atlantoaxial, the vertebra. Okay, vertebra. First, C1, C2 vertebra. Next, Coming to the condylar joint, it is a condyles. Where are the condyles present? Condyles are present in knee joint and TMJ joint. Next, ellipsoid is in the wrist joint and MCP joints. Next, coming to saddle joint, it is like a horse. Saddle joint. Here, first carpo-metacarpal joint. You have to remember thumb in this. Thumb. Next, ball and socket joint. Here, this example they have given, right? Talocalcaneonavicular joint, shoulder and hip joint. All shoulder, hip and talocalcaneonavicular joint all comes in ball and socket joint. Next, fifth question over. Sixth one, shape of the trapezius muscle. Trapezius, T for triangular. It is triangular shaped muscle. So, next one. What are the roots of cremasteric reflex? They are asking. It is L1 and L2. Now, L1 and L2, now, which are that nerves? L1 and L2 branches are genital branch of genitofemoral nerve and femoral branch of genitofemoral nerve. When you stroke the medial aspect of the thigh, the femoral branch of genitofemoral nerve carries efferent and the testicles will move upward. That is because of the efferent is carried by the genital. Now it should go to the genital region, right? Genital branch of genitofemoral nerve. Here the name itself tells that genitofemoral. One is genital, another one is femoral. So first efferent is femoral and efferent is genital. Okay, seventh one over. This is also 2018 question also. So the structure marked in the asterisk sign in the electron microscope indicates what? They have marked the round structure, this one. So what is it? It is a secretory vesicles. This is actually a nerve. Okay, these are the end terminals. Here you can see the secretory vesicle. Next, the identify the structures passing through the foramen marked. What foramen they have marked here? It is nothing but superior orbital foramen. Know which nerve passes through it? It is spinal accessory, no. Ophthalmic artery, no. Middle meningeal artery, no. It is abducent nerve. Now let's see the superior orbital foramen. See, this one is the superior orbital foramen. Here you can see the structure. First, it is superiorly it is by the LFT. It is a V1 is nothing but ophthalmic branch of the trigeminal nerve. So V1, the lacrimal nerve, frontal nerve. This trochlear nerve is the fourth nerve, SO4, you know, right? Trochlear. Next, in the middle of this tendinous ring, there is a abducent nerve, which is the answer for that question. And third nerve, that is oculomotor nerve, superior branch of oculomotor nerve and inferior branch of oculomotor nerve, and inferior branch of this is the inferior to the tendinous ring, that is inferior branch of ophthalmic vein. And this much is the content of superior orbital foramen. Which all nerve comes? Fourth nerve and sixth nerve, obviously. Optic nerve is the second nerve, right? Second nerve, it goes in the optic canal. Okay, optic foramen. And we need ophthalmic nerve also to come here, right? So ophthalmic nerve is it gives by the branch L uh, lacrimal nerve and frontal nerve, and also there is nasociliary nerve that comes in the middle of the middle part of the tendinous ring, that is nasociliary nerve. Okay. Now coming to the 10th question. In the following, identify the muscle responsible for the opening of the mouth. So we have discussed already this question. Opening of the mouth is by whom? Opening means it should depress the mandible. So which is the depressing the mandible? That is the lateral pterygoid. Which is the lateral pterygoid here? It is the marked by D. So here answer is D. So C is the medial pterygoid, A is the masseter, B is temporalis. So let's see. See, first temporalis action is, it is for elevation and retraction. Elevation and retraction. Whereas masseter is mostly the strongest muscle of mastication. It is for elevation. All muscles, temporalis and masseter and medial pterygoid, all are for elevation, whereas only lateral pterygoid is for depression, that is for the opening of the mouth. Whereas this pterygoid is T for T, protraction. Both the pterygoids are for protraction. This you can remember. Okay.